Hi, Ryan. Are you on?
I'm here, Joe. How are you?
Good. Good to see you again.
Good to see you too.
Uh, Welcome back. I'm going to have Stu Madison introduce you.
Sounds good.
Good morning, Ryan. Welcome back. It's been a while. Glad to see you here. For those of you who are not familiar with Ryan, Ryan's currently works with seniors throughout Fairfield County. As an employee of Privitus, he serves as a consultant, helping people navigate the times when the healthcare needs are needed. He also currently serves on the board of the Connecticut Geriatric Society. Often the need for this presentation comes after a crisis happens, and then it's too late. In the world of COVID, quarantine, not being able to be, hey,
I'll go out.
someone needs to silent. Okay. In a world of COVID, quarantine, and not being able to be by your loved ones, this presentation is highly relevant to be able to speak on behalf of the loved one's care. And while you can't predict what can happen hang on a second, you can prepare. If you can't predict, you can prepare. From explaining the options for home care to skilled nursing facilities and everything in between, this talk will educate us on the many resources that can be utilized in providing the best care. This presentation lecture will give a bird's eye view of the options one needs to know before a medical emergency. As a result, we can have more confidence and peace of mind when walking with our loved ones through uncertain times. So with that, Brian, the floor is yours. Ryan, thank you very much.
Thank you very much, guys. So let me start off with this. It's a story where a pastor goes to visit one of his congregants. And he walks into the room to visit with her, and there's an old lady there. And he kind of does a quick observation, and he sees her laying on the bed. Right there's a bedside table, TV remote, a cup of grayish water with some dentures hanging in it. But next to that was a bowl of peanuts. Now he realized he hadn't eaten, so as he sits down, he says, "Hey, sister, do you mind if I have a couple?" She says, "Go right ahead." So they sit down and chat for an hour, and by the time the end of the conversation is done, he realized he ate the entire bowl of peanuts. And he felt a little guilty about this, and he says, "Sister, I have to apologize. I ate all of your peanuts." And she just kind of reached over and she tapped him on the hand and she said, "It's okay. Ever since I lost my teeth, I just sucked the chocolate off of all of them first." And it's times like that where you kind of think, oh, I wish I knew, right? Like, had you known at the front end, you might not have made the choice at the second end. And that is a little bit of an illustration of what I want to talk to you guys about today, where we're kind of calling this talk, "I Wish I Knew," which is simply nothing more than just a preparation and looking ahead to the future. And really want to try and educate all of you. Some of you, this might be familiar, but I guarantee that you're going to learn some things that you haven't seen before. With that, actually, Stu, is it okay if I try and share some content here with everybody on the screen?
Absolutely, absolutely.
All right, here we go. Bear with me, fellas. I'm going to pull this thing up here and we'll see if this works really well.
Yep.
Most of the time when you're trying to use technology, it doesn't want to work as quickly as you want it to, but we'll see how this comes. Here we go, right here. All right, look, it's the title, right? All right, so I wish I knew. This is what we're going to be going through right now. I want to just kind of show you the agenda for this presentation. First thing we're going to be talking about is, does my Medicare cover this? Everybody wants to know, does my insurance cover this? Next, we're going to talk about the 3 levels of care. We'll understand who will be coming into your house. Then we'll talk about the 4 stages of care. Cost is everything. We'll do a cost analysis. And then really looking at, what do I do to prepare? Already shared the little joke with you, but here we go, on to the rest. Maybe with a show of hands, or if you guys want to use the little talk button, how many of you in the last year, because that's a banner year, either have or know somebody who has a trip to the hospital for one reason, not just COVID related, but some reason? Show of hands. All right, a couple of us there. Yep, appreciate that. So if you have, or if you haven't, I guess the question is not a matter of if, but when. If there's any situation that requires you to have a stay in the hospital, not just observation, but you're actually doing some time there, you or a loved one, you are, along with doctors and nurses and therapists, you'll also be assigned somebody called a social worker or a case manager. And their job is to help get you from the hospital back home safely. So there is a phrase that you might hear them say to say, Mr. So-and-so, your wife is about ready to go home, and she is going to be returning home with home care. However, you might need additional care as well that provides more home care. And it's could be a confusing term. So what I want to do is I just want to take a second to kind of understand, like, what is this home care that they refer of? And let's hit the main question, does my insurance cover this? So when we're dealing with this, there's two, I want you to think of a railroad track here, okay? So on this railroad track, we've got two rails that the train sits upon. And as you're going to be going home, there is this thing called skilled medical home care. And then there's everything else. The skilled medical home care, and this is what your insurance will cover. I'll just show it here. Your insurance will cover limited visits by nurses, where maybe they're doing med management or taking care of a wound as it's healing. You'll receive limited visits by physical therapists or occupational therapists, depending on where that injury is. Even a speech therapist, if somebody's recovering from a stroke and they're working on that, or aphasia. And then you also have social workers, and they will come on a limited basis to visit you, connect you to resources in the community that maybe add extra layers of support. And then you'll also get a very limited nurse's aide who will come out for about 1 to 2 hours a week if there's any bathing or cleansing or just health hygiene issues that need to be addressed. So for the most part, fellas, when somebody's coming home from a hospital stay and they say you're going to be going home with skilled home care, this is what it entails, what's popping up there on the screen. And you should be okay. If, however, the doctor or case manager or social worker says, you are probably going to need some additional services that are private pay services. Private pay is this generic term for insurance doesn't cover it, right? So let me give you some other layers here. If do we have any veterans out there, maybe with a show of hands? I know we do, right? Just claim it. There you go. Thank you guys very much for your service. In addition to being able to go to the VA, there is also a program out there called Veterans Aid and Attendance. If you have a pen, write that one down. This is a good one. Veterans Aid and Attendance. Not too many people know about this, but this is a service free for your service for veterans and their spouses who may need additional care at home. It is, you have to qualify for it. I can talk to you about that later on how to do it, but that is one form of money to go towards recovery. And that is a long-term program. It's not just for 30 days. It is until such a time comes that you don't need it anymore. So be aware of that, look into it. Another program that is around is something called long-term care insurance. This is different. It has the word insurance in it like health insurance, but it's different. Its specific function is to help you out as we get older and we need more additional care at home, wherever home might be. So look into that as well. And then there's the third option, private pay, which strictly means exactly what it sounds like, private pay. We're looking at your checking or savings accounts. When private pay services are required, Again, this is going to be kind of like a little functioning and following down the rabbit hole here, but I'll try and keep it simple. Private pay services really can break down into 3 different levels. Here's your options, and I'll give examples just so you understand what we're talking about. Companion care is the first level. It's basic 101. Companion care is simply when you need almost like a tag team approach to caring for somebody. In other words, I need you here with my loved one so that I can go run and drive and go grocery shopping, or reverse it. I need to go grocery shopping, or I need to go pick up prescriptions. I need you to stay here with my loved one. A companion care is when an aide will come in and be by the side of that loved one and take care of the things around the house that need to get done. I've seen situations where aides have actually cooked alongside of people who enjoy cooking, or they've just cooked for somebody, or they've done the laundry, because when you've had a broken hip, it's hard to go down the stairs, right? The second level that we're dealing with is personal care. Personal care is a term because of what's in the name. There's a personal touch, a hand-to-hand connection that goes on. Personal care is really designed for somebody's health and overall wellness. So this could be help getting dressed, maybe a stroke or something. It's hard to undo the button, so we can help them get dressed, or a shoulder injury and it's hard to pull that clothing on. It could be for something like having some bathing or cleansing where it's just hard to reach or hard to get in. Personal care can also involve somebody who's just recuperating from walking, and they still might pose a bit of a fall risk, and they need that hands-on hand support, hand-on body support, to ensure that they're getting better. And then there's the third level of complex medical care, and I'll talk about that in a second, but let me just say, many times the companion care and the personal care really go together. It's kind of like a peanut butter jelly and the bread all in one, because sometimes you need just one, sometimes you need the other. Often we need both, and that's okay. They can all come together. The complexities, that's an issue for some of us. When we're dealing with the complexities, sometimes an aide coming to the house is not enough, and you might need a nurse. I would say in my experience, I'm seeing this out of 50 patients, 2 might need something like this, or out of 25, 1, however you want to go with the lowest common denominator. So when might you need a private nurse? A private nurse would help in a couple of situations. One is when insurance hits a wall. 2 weeks ago, our company got a phone call where somebody had a really severe surgery and wound that was healing, and some colostomy bags that needed to happen. And at that point, insurance said, we will cover your dressing changes and everything 3 times a week. Unfortunately, she required 7 days a week. So at that point, they needed to hire additional help for a nurse. Another situation where this comes in is when a family member, they just want to go home. Maybe a show of hands, have any of you experienced a situation where you were actually quarantined from a loved one who was in either a skilled nursing facility or maybe the hospital themselves, where you wish that you could go see them, but you couldn't because of restrictions? Right. So there have been some patients who just say, I want to skip the quarantine, just bring me back. And due to the complexity of their situation, that might require a nurse. Again, we had somebody who had to have IV antibiotics into their arms, and that required a nurse to do that. So we were able to provide a nurse there. And then this third situation that we deal with at times is just something called a chronic ongoing condition. Couple of situations for this. We've worked with people who have Lou Gehrig's disease. We've worked with people who have had really bad cases of cancer. Things where, along with an aide, they might need some additional nursing professional support. Again, it's not for everybody, where they might have that need. But when it's there and the need exists, there are resources available to fill that need. So just be aware that that is something that is an option for some of you. So now that kind of begs the question, all right, well, I need this. It's coming. But who is it who's coming into my house? This is a really severe question, especially with a lot of the horror stories that we've all heard, right? Somebody came in, took all their stuff and left. And if I wanted to open this up for discussion, I'm sure that you could add some stories as well. But a little bit of work on the front end is going to help you out. And here are some questions just to get you started to understand when you are getting those private pay services. These are some questions you should be asking. One, are those aides, nurses, therapists, etc., are they actually company employees? Are they insured under the company itself? Here's why you want to ask that. Because let's say you find somebody who knows somebody who knew somebody who took care of somebody, and you hire them yourself. You are now technically their employer. So that means that you, under federal guidelines, are responsible for their taxes and payments getting made, which can be a headache. But the higher risk between all this is that if you had somebody who came alongside and started working with your loved one, let's say they needed some help standing up and they themselves got hurt, now you would be liable for the workman's comp or any medical bills that might come along because you're their employer. So you want to make sure that you're working with a company where the employees really are their employees. Next, you want to check, are they certified and licensed aides? Here's why I say that. Has anyone here taken a CPR course before? I did about 15 years ago. Now, I could say, yeah, I am certified, or I could say I'm trained in CPR, right? Well, yeah, but I'm not sure if I want to be the first guy doing CPR on your loved one because things have changed over the last 15 years. So when somebody is certified and licensed, that means that they have a current standing and regulation to know best practices at this given time. So check on that one. Lastly, do you background check all your staff? Kind of, I don't want to say obvious, but we still got to ask this one, right? We want to make sure that they are safe as they're coming into your home. Background check, drug testing, criminal background check, even driver's record check if that stuff's going on. And lastly, I'd say this, make sure that you hire the company, not the caregiver. Here's a quick story. If you needed some help with your taxes and I said, listen, I've got the best accountant and retirement planner, his name's Jeff. He's taking care of me. He's phenomenal. You have to specifically ask for Jeff. He'll take care of your finances, both in the present and in the future. And you say, geez, this Jeff sounds like a great guy. All right, what's the name of his company? And then I reply, he works for a guy named Bernie Madoff. And just get in touch with him. Jeff is the guy. Well, now there's a huge difference, right? Between getting Jeff to work for you and knowing that Jeff works for Bernie Madoff. Holy cow, guys. So when you're looking to say, listen, you gotta go with this organization, but just specifically ask for Mary or Mark or John or Jane. Do yourself a favor, hire the company, not just the caregiver. You will thank yourself later in the end. All right, leaving on that one. Now, sometimes I get some fellas who are asking me, do I need to have an emergency, like a medical emergency, before I can get help? Well, listen, the statement stays for itself. And I know you guys could all finish this if I turned all your mics on, but an ounce of prevention is worth a pound of cure, right? So the answer is no. You do not have to wait for a medical emergency. In fact, I implore you to start having this discussion and objective research before the emergency happens. In fact, by looking into the forms of help that are available, you actually prevent the medical emergency. I'll give you 3 quick examples. We we always come across this, is that when somebody has a situation where they're starting to need help, most of the time you say, so how did this happen? You know, how did you find yourself in this? Most of the stories say, well, I've done, or I did what I've done for the last 50 years, but this one time didn't go so well. And when we kind of scratch the surface a little bit more and try and understand, well, what was that? We had one guy who said, well, I was on the ladder like I'm always on the ladder this time of year, and followed, fell. Now, this guy was 95 years old, and he decided to clean his gutters like he always cleaned his gutters for the last 60 years. And his wife said, you really shouldn't be doing that. You should get somebody to help you. And his answer is, I'm fine. I know what I'm doing. I've always done it this way. But at 95, the hand-eye coordination just wasn't the same as it was when he was 25. All right, that's one. Another situation is the wife who's done the laundry in her house for the last 56 years. Suddenly, though, carrying a bag or a basket full of laundry going down the same basement steps, the weight distribution wasn't what it was as when she was 40. She took a fall, had the consequences. And then the last one was somebody was just shoveling the driveway with the snow, as they have been for all the rest of the years. And the ice was out, took a slip and broken hip. Bummer. When people look back on it, they say, if I had just spent the $25 to have somebody do this, I wouldn't find myself with $25,000 in medical bills. And when you're looking at the cost analysis, it kind of makes sense, right? That's why we say an ounce of prevention is worth a pound of cure. And I really encourage you guys to kind of take that objective look at some of this stuff. And if this is not for you, I know that you know somebody who's kind of gone through these situations. And I really want this to be an opportunity so that you can be prepared to say, oh, you know what, we need to be thinking about this. Now, as you think about the future, and I know we all have, home is great. But I want to hit with you guys right now 4 different levels of care that are available for us all. Here's how they look, because your personal preferences matter. As we get older and assistance is needed, there's 4 options. 1, having care at home. It's kind of what we've been talking about and self-explanatory. Many people, when polled, I think the number is 85% of most Americans have the intention to just stay at home. They don't want to go anywhere as they go into their retirement years, which is awesome. There's a lot of memories there, and there's a lot of good times. We've got community, we've got organizations such as this. Speaking of which, Stu, maybe I can go to the golf outing or the fishing trip, because these things look amazing. I wish I was
Sure.
retired right now.
Absolutely.
That's perfect. And walking the bridge sounds phenomenal. I drive it, I just haven't walked it yet. I should. My wife says I need more exercise. Anyways, if you want to stay at home, make it work. And these are some of the things that can happen. Second option is an independent living facility. They are everywhere these days in this area. An independent living facility means that almost like a townhouse situation, right? You get this great living situation without the responsibilities of the upkeep. You're also in more of an intimate community with people of your own age demographic. And should extra services be necessary, they are available. But for the most part, it's your own home. Decorate it however you want. Enjoy the area. There's several here in the Stamford area. The next one is an assisted living facility. Everyone kind of knows about this type of stuff, but the general breakdown and the separation of categories is that when someone's in assisted living, the description is in the title. It means that they need assistance, daily assistance, in their regular living. Meals would be provided for, cleaning services would be provided for, assistance and physical therapy might be continuously provided for on a daily basis as needed. And many people who are moving into the assisted living generally have a requirement of about 3 to 6 hours of need to help them continue to live their life as they were. Many times that's kind of getting up and at them. They live their life during the day, and then maybe a little bit of help at night as they're kind of wrapping up the day. So this is a progression from the independent. Some people actually really prefer this. Some people just need it out of necessity. And then the final situation, which the term is a nursing home, is skilled nursing facility. Over the last 10 years, the demographic and the responsibilities between hospital, nursing home, assisted living has really shifted. And by that, I mean this: due to the nature of the baby boomer generation and Medicare, and we know that the financial turmoil of Social Security, et cetera, hospitals have become more of a emergency room in general. Does anyone remember when your wife might have had a kid and your wife was in the hospital for at least 7 days just to recover? Now, when a woman has a baby, they're out within 2, generally. Just get the need done and move on out. If you had a medical emergency or a surgery, yeah, we think you're pretty well enough to go home. Really? I've got tubes in me. Well, we're going to send you home and you'll be just fine. Call somebody, call your kids, they'll take care of you. We've got other people to go. There's a real, like, just moving people out as quickly as they can. So what that does is that puts more of a strain on a skilled nursing facility, which is like a step down. Before, you had this mentality of nursing home. You go there to die. That's not really what it is anymore. Now, a skilled nursing facility is you go there to get better. So if they talk to you or a loved one to say, you're going from the hospital to, they use the term rehab center. It's a skilled nursing facility. So you'll be going there covered under your insurance for several weeks, as long as necessary, so that you can recover to a point where you're able to live much better than you were before. Again, sometimes you need the help at home, but for the most part, they get you back to normal, which is the goal. Skilled nursing facility is not designed for long-term. So you go from hospital for short, skilled nursing to a little bit longer. And then that skilled nursing facility, their design is to then get you home, wherever home might be. That might be assisted living, that might be independent, that might just be your regular house, and you can go over there. There's places here in the Stamford area like Edge Hill, Waveney, Long Ridge Rehab. These are all skilled nursing facilities that are designed to help you go from hospital to transition. You work on your physical therapy, occupational therapy, speech therapy, recuperate. And then even there, you'll be working with case managers and doctors and therapists to say, this is what it's going to look like for you to go home. These are the things that you need to have in place. So listen, observe, prepare. So let's take a look at a little bit of this cost analysis. All right. So I don't know how many financial guys we have there, but here's the numbers as they are right now. And I'll just kind of let those speak. These numbers are based off of an average of 21 hours of care per week for today's standards. So to have an aide come into the house, we'll just break this across. It's about $650 a week, or yearly cost of 30, just call it 30,000, 32,000. If you move into an independent, they go by a monthly charge. It can average anywhere between $6,000 to $8,000 a month, which shows you what it is for the year. If you're going into assisted living, here it is. Boom, monthly, yearly. And then skilled nursing. Again, remember guys, the skilled nursing that was if you needed to do private pay. Most of the time insurance covers, but if insurance runs out and you say, I'm going to just stay here, and it switches over to private pay, it's an expensive option. Okay. Obviously, even if you're bad at math, you can see why the US government and medical system is trying to get more people home faster. It's a It's a money situation. It's a budgeting expense. It is far more economical to have people go home. But sometimes we still need support with that. And that is where this home care aid comes in. Why are we sharing all this? Today in the news on Yahoo, it was reported that 2 planes over in Colorado collided with each other mid-air. And miraculously, you can find this on the news, miraculously, both planes, all the passengers in both planes survived. One guy landed a plane without his tail, which is incredible. The other one had a built-in parachute into their small Cessna plane, and the plane landed nose down. Now, for those of us who have been on planes, do you guys recognize what this is?
Yeah.
This is a picture of that little pamphlet that they stick inside the seat. Now, there is a reason that they encourage you strongly to read this thing before the plane goes up. And in case you don't know why that is, I'll explain. It's because in the event of an emergency, the last thing you're doing is looking for this pamphlet. When the plane is in a, I don't know what degree this is, but we'll just call it a nosedive. You don't look over and say, sweetheart, do you remember where that pamphlet was? Because I want to know where the flotation device is. Can't remember where it is right now. In fact, I can't even breathe right now. So that's it. No, they're telling you all this on the front end so that you will take the time to prepare, familiarize yourself, anticipate, locate, and be prepared in the event of an emergency. This is why when Stu read to you, you can't predict when you're going to have a crisis, but you can prepare for a crisis. Show of hands, do I have any Boy Scouts out there? Former Boy Scouts, grandkids who are Boy Scouts, or Girl Scouts for that matter. But what is our Boy Scout motto? Remember that? It's be prepared. It's be prepared. And if anybody has ever gone through a situation where you and that other person next to you, and you prepared and they didn't, the whole countenance shows everything, does it not? You're walking, it's hard, but you're walking forward because you're prepared. The other person has stress upon stress because they aren't walking. They're just sitting in their anxiety and they're sitting in their crisis, looking for somebody to grab hold to. And what I want this to be is not a wake-up call, but a little bit of an enlightenment to be prepared, to review right now, just as this thing is, what's taking place. Which I want to focus in on one more little element here of this picture or this pamphlet. When I zoom in, you'll see this picture here right there. It's a funny thing that they say this until you actually think about it, or maybe if you've experienced it yourself, and I hope none of you have. But they always say, passengers, be sure to put your own mask on first before helping other people. Which, as a parent, and I know several of you out there are parents, you would think, no, I got to help my kid first. Or I have to help my wife first, or I have to help my spouse first, or my partner first, or whoever it is. But the reality and the evidence shows that in the event of a crisis or an emergency, unless you are also taking care of yourself, you'll have a quick burst of energy to help that person, and then you slump over. In this case, it has to do with oxygen. You want to make sure that you are having your own supply lifeline coming into you so that you can take care of others. And so often in my line of work, I will walk into a house or a home and they'll say, here is the patient. And you look at the patient and they're smiling and they might have a bum leg. But then I'll look over at their spouse, who is the caregiver, and that spouse looks like they've aged 20 years and is about to have a heart attack. Why? It's because they are giving and giving and giving and giving, but they're not providing enough self-care for themselves. So fellas, do a gut check. Start with yourself. Are you taking care of somebody? And if so, are you taking care of yourself in a way that is going to sustain you for the long term to take care of that other person? Maybe you are doing well, and for that I congratulate you. Maybe you're not even in this situation, and generally I might have a more of an interactive discussion. Well, if it wasn't on Zoom and we were in person, and we can do that for another time. But if you know somebody who is the caregiver, then I would encourage you to have this conversation with them, to simply say, how are you doing? Now, you know, if it's a guy, he's going to say fine, or we're hanging in there, right? That's what we do. But go a little bit deeper. You could ask a question to say, hey, listen, I know you've been taking care of fill in the blank. How's that affecting you? How's your health? Allow them to take a second and process that. Allow them to maybe recognize, you know what? I guess I'm not doing as well as I could, or I'm a little tired. We've been wanting to go on vacation, but COVID has trapped us in, and it's put more of a burden of care on us. We had a lot of phone calls come into our office by adult children who said, I was the caregiver for my parents, or I was helping, or I was supporting my folks out, but we're separated. We used to be able to travel. We don't travel. We used to be able to visit. We're not able to visit as much, if at all. And so that puts so much more of the burden on those loved ones. It's actually funny. I'm very close to somebody who has parents. They're good. Parents are active. They're in their 70s. And last week, the parents came down with COVID, both of them. And this guy was like, oh my gosh, now I can't take care of my parents, whereas before they used to. And what do they do in that situation? Kind of caught him off guard. So this is a little bit of an opportunity here to be thinking about, well, what plan do we have in place? What do we need to bring into the equation to make something happen? This guy had ended up reaching out to somebody local in that area, professional company who was able to bring the medical assistance necessary over to them because he himself couldn't. So I want this to be an opportunity for all of you to understand that there is a lot of different forms of help available. And as we get older, as we see people out there, there are things that we need to be thinking about ahead of time. So I want to give you 4. 1, I would really strongly encourage you, if you have an insurance policy, supplemental of any kind, to call your insurance and ask them, do you cover home care services? In 2020, right before the pandemic, in January, there was a new bill that was passed that now allowed some insurance agencies to cover that private pay services. Before they didn't, before it was strictly the skilled nursing. Now there are some that are out there. So I would encourage you to call your insurance, number 1, and say, do you cover, here's the term, non-medical home care? Ask them if they cover that. If not, you might want to look around at some of the other supplemental insurance companies that do, because it's a great service to have. Second, want you to consider looking into long-term care insurance options. If you have that policy, look at it, understand how it is. There are as many different types of long-term care insurance policies as there are car dealerships. Some will give you one thing, others will give you another. You think, oh, I've got a Maserati. Turns out you've got not a Maserati. So explore and understand how it works for when the time comes to start that up. No joke, 2 weeks ago, I was meeting with a woman who said, I've got this long-term care insurance policy. I think I'm going to cancel it because I'm just, I think it's a waste of money because they told me I can't get my money back. When we actually looked at the policy, we realized that over the years, she had paid $20,000 each month, total 20,000. But she was now entitled to $200,000 of care and coverage. And I said, lady, do not cancel your policy. This was well worth the investment. Next thing I would encourage you to do, even right now, there are a lot of home care agencies out there. You have the choice of which company you want to work with. I would start talking to some of them now, both in each category. One, the skilled medical company. Because you know what, when you're at the hospital and you're ready to go home, they'll say, you're going home with home nursing. Who would you like to use? You actually have a choice. Many times we just say, well, whoever you think is best, and they'll pick somebody. But you actually have the right to choose. And with Google reviews that are out there, you can do a little homework and understand what's out there. And then the same thing for non-medical or private pay agencies. Remember, find out about the Veterans Aid and Attendance as well, because there's some money available to many of us who deserve it. Also look up non-medical home care agencies, do some reviews, understand what the options are. And if you want some more resources, I can provide that to Stu. And Stu, if you want to email that to the guys afterwards, we can make that available. And then fourthly, and this is really what I want you guys to focus on, is be objective. Be realistic about what your circumstance is or what your friend's circumstance is. Too often we disguise everything with it's fine, or it's always been this way, or we'll get by. That's not worth the life of living, right? That's called compromise. And I don't want you guys just to compromise and live with suffering. There's resources out there. And a lot of times we as men have a hard time asking for help, right? I mean, I know I do. But in my experience, by bringing in help and allowing ourselves to be vulnerable and saying we need a little dependence, we have a little dependence, it allows us the freedom to continue to live an independent lifestyle. If we want to be stubborn and say, I'm fine, I'm going down this way, you're going to go down that way a lot faster. But if you say, you know what, we could use a little help here. We need a little additional help on the front end. By front loading the care coming out of a crisis, you actually get better faster. And it's a really amazing testimony to see somebody back at their feet, back in the men's group, back at the association, say, hey, didn't you break your hip? And you say, I did break my hip, but guess what? I'm getting better faster. I got some more extra help than I thought I could. And here I am. You know, my insurance was going to pay for 3 rehabs a week. I paid a little extra. I got 6. I got back twice as fast. By admitting your need, you actually bring health to the situation. So take that humility. Get the support that you need. And that will really help you prepare for the future. For any of you guys who want to ask more information offline, this is my contact information. I'd be happy to chat with you. Provatus is one of those private pay companies. What's unique is that we do, yes, the private pay aides, but we also have nurses as well. So we are able to take somebody's home and turn it into an ICU room. And we've actually done that before if they needed to. So happy to work with you guys on that stuff. I know a lot of this topic brings up many questions, and I would be happy to take any questions, or maybe some of you have had some experiences with this before in the past that you'd like to share. So I'd like to open that up right now. We have a couple more minutes here. So does anybody have any questions? Lloyd, I see your hand popping up right now. Go ahead.
Yes, it was very informative, but I'd like to explore something else.
Sure.
Medicare used to have, in order to continue benefits, you had to show progress. And then there was something going on where they were going to stop it, didn't stop it. I got lost in the rhetoric. And I was wondering if you could clarify that for me, please.
I think I understand your question, Lloyd, but put it in a sentence. What is your specific question? Understanding Medicare, what is covered?
What is, when you get long-term type Medicare payments, do you have to show continual progress?
Oh, for the long-term care insurance?
Pastoral concepts,
For long-term care insurance?
long-term care paid for by Medicare.
So when you have Medicare, and you are in a skilled nursing facility, and this is all covered under your insurance, what they are looking for is, yes, you are correct. If I started, let's just say, a broken hip, and each week I continue to show more progress, Medicare will continue to pay for those services. But once I hit what they'll call the term a plateau, in other words, this is as good as I'm going to get, Medicare will say, we've done our job and it's time for you to consider going home. And what that looks like is now up to you. So that's when they'll say, you know, Lloyd, you want to go home on your own? You can, but we might recommend some additional care. Ben, I think I saw your hand up earlier. Is that correct? You'll just have to unmute yourself.
Who was that?
Ben Ginta.
Huh, I don't see it.
No, all right, guys, raise your blue hand if you have any questions, and don't make statements, just direct questions, please.
Jerry Kranz.
Jerry, take your question.
Thank you very much for the information. Could you just give me that veterans group one more time so I have that properly?
Sure. It is called Veterans Aid and Attendance. That is the name of the program. If you Google search that, you're going to find two things. You're going to find a slew of companies that will help you qualify for the program, like take you through the process, because with everything government, there's paperwork to get it done. But you can also go onto the VA's website where there's a process as well. You can either apply, it's kind of like taxes. You can either do it on your own or you can hire an accountant to do it. The accountants know the system, right? So, but the program is called Veterans Aid and Attendance.
What type of qualifications do you need besides being a veteran? Is there a monetary?
So, yep. So there needs to be involved. You need to be, you have to have served in active duty or a time of active in Vietnam is even considered one of that. Korea, World War II, some other guys, Persian Gulf, etc. There needs to be financial qualifications based off of your resources. And those are the main two. There might be a couple others as well, but that's what you're going to be looking for.
Thank you.
You're welcome. I can only...
Guys, if you have more questions, raise your hand, but I have a question, Ryan.
Stu, go ahead.
You're talking about the qualifications for when you're picking people. You just mentioned background checks, but how do you actually do a background check?
So our company, like anybody, you can go through the federal government to do a criminal background check. So there are several companies out there that you can use. So if I am going to be a caregiver, our company will say you have to, you give your name, social security number, et cetera, and your consent, and they run a criminal background investigation on you. And then depending on how that comes back, we'll determine whether or not the agency will hire that person.
Okay. I don't see any other questions.
Uh,
So
Dick, Dick Fisher, do you want to clarify your little comment?
Yes, there was a lawsuit in Connecticut with regard to continuing care for home care or nursing home care that there is no plateau standard. If you can continue to benefit from therapy, even though you're not getting a higher level each time, their Medicare will continue covering it. Not all nursing homes will follow that, but if you appeal it, the Center for Medicare and Medicaid accepts it and has set out material on that. I also will say that I was starting to type this in. To get VA aid and assistance, if you use one of those private organizations, they are generally looking to also get you to invest in certain benefits where they make the money. They can't charge for assisting you in doing the aid and assistance form. And the best way to get aid and assistance is to go to DAV, Disabled American Veterans. They have an office up in Newington, across from the VA regional headquarters, and they don't charge for it. Thanks, Joe.
Thanks,
Thank
Rich.
you,
That's
Dick.
super helpful. Very, very helpful.
That is, with all of that though, isn't the overriding the time limit Medicaid, Medicare, I'm sorry, pays 100 days. After 100 days,
Yeah, you can't exceed that. That is federal law.
so whether you're improving or not improving on the 100th day, you're on your own, or the 101st day.
Correct.
yep.
Okay. Yeah, I've been going through that for the last 2 years.
That's
So
not
Brian-
something to brag about, Joe.
No, my wife used up the 100 days and then had the home care that came in to supplement for another 2 months.
Got it.
Yeah.
Got it.
So Brian, thank you again very much. This is extremely valuable. And I just want to stress, because I know I'm guilty as anyone else here, of you think you're okay, you struck me by saying, I've been shoveling for 40 or 50 years and it's snowing out and I'll go do it. And it's things like that can have serious consequences. You really do need to think about, it's a very important topic you mentioned there. And so it's everything you told us, I think, is extremely good advice. And we should seriously think about it. I'm sure some guys are saying, well, he said it, but I don't care, but I'm really in good shape. But they really need to think about where we are in life. And so again, thank you very, very much. There's a lot of serious things you talked about. And so again, thanks for joining us. And I'll turn the program back to Joe.
Thank you guys very much. Let me know if you guys have any other questions. I'm here.
Okay, thanks.
Brian, thank you so much for another great
Thanks.
presentation, and really appreciate the information that you pass on to us. Hopefully in another year or so, we'll have you back again, updates or something, new that you have. As always, guys, stay safe, be careful, and see you next week. And please, board members, stay on. Hopefully we're starting a few minutes earlier so we can get done that much sooner. Okay, everybody else can log off.